we deal with that? Are you finding a spike in issues that are related to this crisis? And then ultimately, what's to be done?
Well, I have to tell you, it's just alarming, you know, across the country, the number of opioid cases that there are. There are more deaths attributed to drug overdoses than there are homicides and car accidents.
That's
and the
kind of
Bronx,
unbelievable.
yeah, and the Bronx is right up there throughout the country, not just, you know, New York State, but throughout this country. This county has a problem, but we've always had the problem, Gary. You and I know, we both grew up in the Bronx our whole life. Heroin is not new in the Bronx, but, you know, it's going into communities where it's never been before, and that's alarming because we don't want it to spread any further than it already has, but it's become a real problem. So now we need to look at those communities where it's always been there and the response hasn't been great, so that we need to do something to treat it there, as well as to make sure we go out into the communities where deaths are happening now to make sure that they don't happen again.
What kind of things need to be done? I think you told me just when you sat down that there's a working group coming up, because this is yet another one of those issues that it's not, you can't just say to the cops, we'll bust everybody and solve the problem. You also can't say to the medical community, somehow figure it out. You know, I mean, what has to be done now?
You're right. So we have a working group now. It's something that we're calling Operation HEAT, which is heroin enforcement and access to treatment. And what we're doing is that we're doing this intelligence-based. We're looking at the data. We're seeing those areas where the most deaths are happening, where the most overdoses are happening, even though people are saved. We're going to those areas because those are the areas where we're probably going to lose more and more people. And we're working.
Excuse me, that sounds like the CompStat program is really what we're talking about on a different level.
Right, it's similar, but you know, we want to go, we don't want to just pick an area, well, let's go over here, and it's not as much of a problem as there is in another place. So where we want to go where the problem is most prevalent. And we're putting together a working group with my staff, members of law enforcement and public safety, public health care, health partners, city agencies, everybody, so that we can look at this this problem holistically and see what we can do. So, you know, housing is going to be there, the Office of Mental Health, the hospitals, Montefiore Hospital, NYPD, sanitation, the fire department. All of these agencies and these stakeholders together in these communities to come up with
You're going to need some economic empowerment and educational imperatives so that people have alternatives to the things that they're doing.